in 44 states out of the nation, you are, to some degree, you're able to use a bioptic telescope for driving purposes. And so North Carolina passed its law around 2013 or 2014. So this we've been doing for the last 6 years, pretty much all of the prescribing for the state of North Carolina. And we, with the help of the DMV Medical Review Board, actually created a training protocol because it wasn't defined by the law that actually enabled people to drive with telescopes. So we've grown a lot in 6 years, and we probably fit about 150 bioptic telescopes specifically for driving. That number could be more, but every state varies in what the requirements are. So I'm not going to get into what it is for North Carolina because that's not going to be important for your state, but just know that this could make a huge difference as far as continuing to drive or not to drive. So know who the good candidates are for the bioptic telescopes. I know that Dr. Green gave a talk earlier, so I don't need to rehash or reiterate his slides, but I started off with designs for vision, and I've sort of kind of stuck now with most of the Occutech products. And for fairly similar acuity, 2100 or better, I like the sight scopes, and it's for people that have maximum restricted driver's license now in North Carolina. They could get the restrictions basically removed with the device, so it gives them more freedom. You can have a clip on, which means you're not permanently having something mounted to your glasses. But when it gets more complex, the vision gets worse, then we have this very sort of robust selection of different types of telescopes with different pluses and minuses that I'm sure Dr. Green could share with you, or you could talk to me or my team about, and we could give you some pearls with those devices. You know, I think the most important thing in thinking about who's a candidate for a bioptic is it really boils down to the total picture. It's not about visual acuity. I mean, visual acuity gives you the DMV will give you visual acuity sort of criteria for who they will let drive with a bioptic telescope, but ultimately it's the total person, because driving is the total person performance. And for me, the ideal person is a Stargardt's patient. We probably fit at least 100. Regardless of age, if they're new onset or they've had Stargardt's for multiple years and they lost their driver's license and then they're resuming driving again. It's just ideal for vision that burns out at a certain level and you have preserved peripheral vision and your scotoma is pretty finite in size. Optic neuropathy and atrophy, we've had success, case dependent, but success there, in albinism, depending on the severity of nystagmus that can be associated with that. In general, younger patients, mostly because the learning curve is not as hard for them because there is a behind the wheel component and a clinical component to learning. So if you have a learning challenge, that makes adapting to this technology not as easy. If you're basically healthy and you don't have any other physical motor impairments like cerebral palsy or anything else that can make driving a challenge, then this will be pretty easy for you to adapt to pretty quickly. And if you have a good driving history, you have an impeccable driving record and you're a Stargardt's patient, never had a ticket, never had, whatever, an accident, it's hard for the DMV to give you a hard time with a good driving history. And then I'd say the counter to that would be anyone that has a highly variable visual acuity, like people receiving anti-VEGF injections, whose vision can fluctuate, or if their vision's going to go downhill pretty quickly, don't waste their time or money on a device they're going to outgrow. And there are a few different conditions that I've listed for that. If you think
an excellent presentation, and I would love to have you go on, but we're going to have to stop. So you want to just wrap it up? And
yeah, this is actually my second to the last slide. Okay, so if the more the patient has going on with physical, motor, cognitive, whatever else, or sensory hearing, the worse it's going to be. So my last slide, when in doubt, road test. The people that you don't want to, that are going to make you uncomfortable at the end of the day, that you need to have a behind the wheel assessment, are going to be people with variable or fluctuating vision, history of a motor vehicle accident or traffic violations, people that are overconfident in their ability to drive, any obvious cognitive decline or issues, and someone that's got a complex sort of physical motor and other package. This is a very we've done 4-hour workshops on this. So if you have questions about this, I'd be happy to take them. And here are some national resources to help you make these decisions. Thank you.